Guidelines are very important, and especially in primary care. A primary care doctor has to treat all kinds of patients, and proper guidance about diagnosing the patients and optimized treating strategies is very important, as it provides the physician and in the end the patient as well with clear understanding about what is going on. In the Netherlands we have more than 100 guidelines for primary care practice, and the guidelines are developed by teams of practicing GPs, academic GPs, supported by hospital specialists, and thereby they cover the whole range of problems a primary care physician can encounter in his daily practice. Policy and interventions, especially when they are endorsed by local or national governments or by professional organizations, can have a huge impact because they interfere with practice by physicians, but also expectations of patients, pharmacy regulations, so they can cover the whole range of players in the field of antibiotic use and prescribing. In the Netherlands, we have various examples of very effective policy interventions or policy interventions with high impact. A couple of years ago, all hospitals in the Netherlands had to establish A-teams, and A-teams in hospital are responsible for prudent antibiotic use within their hospital. A-teams are composed of medical microbiologists, of internist ID specialists, specialized nurses, and this team is responsible for having oversight of last-line antibiotic use, adherence to guidelines. They make specialized plans for their hospital. As I mentioned earlier, in primary care we have the prescribing guidelines, which are advocated amongst GPs, supported by education and patient materials, which are endorsed by the professional group of GPs. Other successful policy interventions endorsed by the government is a yearly monitoring of antibiotic use of all practices. This gives informative information by the practicing GPs how they behave in relation to their colleagues in the region or colleagues in the country. And it's really needed that the government endorses this structural surveillance of antibiotic use instead of every practice of GP doing it in their own way at moments it suits them. Now it is compulsory and really endorsed and helped by national government.